Good afternoon, good morning, or good evening, depending on which part of the world you're in. Welcome to this webinar, the 8th webinar of ADBA. My name is Dr. Zulkifli Ismail. I'm a pediatrician from Malaysia. And with me co-chairing this session today is Kamran Rafiq, who is the co-founder and communications director for the International Society for Neglected Tropical Diseases, or ISNTD. And he has been championing World Dengue Day all this time, and to commemorate, to coincide with the ASEAN Dengue Day. We are members of the Asian Dengue Voice and Action Group, or ADBA. And ADBA is a group of consisting of pediatricians, infectious disease specialists, epidemiologists, and so on. And we have been organizing seminars, workshops, and webinars since 2012. And the first Asian Dengue Voice and Action Group workshop was held in Bangkok in September of 2012. And a bit of history here, right? And then the second one was held in Kuala Lumpur in March of 2014. And the third one was held in Chiang Mai in January of 2015. In addition to these sort of workshops, we have also been organizing the Asian Dengue Summit, the Asia Dengue Summit. And the Asia Dengue Summit is an annual event. The first one was held in 2016 in Bangkok. The second one was in 2017 in Manila, followed by Kuala Lumpur, Jakarta, Singapore in 2022. And the next one in 2023, which will be on the 15th and 16th of June 2023, will be in Bangkok. And Bangkok, and that will celebrate the the 14th ASEAN Dengue Day, which is celebrated on the 15th of June every year. So we are trying to make the World Dengue Day also being celebrated on the 15th of June every year as well. So with this series of webinars now, this is the 8th of the series of webinars that we have been organizing since we started in October of 2020. And we have covered all about vector control and the Wolbachia, infected mosquitoes, and everything else in dengue. So this year, or this time around, we're going to talk about the health economics and public-private partnership in terms of dengue prevention. So to give the first, we have two very prominent speakers who will be talking on this. And the first one will be talking about the economics of prevention and control of dengue. And to give this talk is actually Professor Dato, Dr. Syed Mohamed Aljunid. And he is the first Malaysian to obtain a PhD in health economics from the London School of Hygiene and Tropical Medicine in 1995. He has served in University Kebangsaan Malaysia, which is where I used to work before, also in the United Nations University, and currently he's a founding professor and chair of Department of Health Policy and Management at the Faculty of Public Health in Kuwait University. And he's also appointed as a consultant and advisor to the Kuwait Ministry of Health Control of COVID-19 pandemic and the implementation of the case mix system, which he champions all around the world. And he's also an advisor to many of the developing countries on public health and also health economics issues. So it's a pleasure for me to again meet Prof. Syed, whom I have known for a long time, and also to introduce him now. And he's going to talk on the economics of prevention and control of dengue. The screen is yours, Prof. Syed.
Yeah. Thank you so much, Dr. Zul, for a kind introduction. I'm trying my best to try to explain and discuss the issues related to the economics of dengue prevention and control. And I'll be touching on the number of issues I will start by talking about the global burden of this disease, because that's a very important aspect that we need to understand before we can actually do a proper economic evaluation. And then after that, I will share with you some of the research which has been done in the developing countries, and some of these were done in very close to us in Asia. And then we will draw the conclusion from that and see what we can learn about dengue in terms of the economics aspect of that. I'll share my screen now. Okay, if you look at the global burden of dengue, I think this has been widely reported in WHO and also the people who are doing the studies on global burden, especially the Institute for Health Metrics. It's estimated that there will be around 400 million of infection per year, and the 96 million of them manifest clinically. And in Asia itself, it is estimated that 1.8 billion people in this region actually exposed or are at risk of developing dengue. And it was reported globally, which probably be underreporting, 38,000 deaths per year, this in 2016. The Delhi's work by the Institute of Health Metrics stated that in 2017, 2.9 million Delhis were actually lost as a result of dengue. And in the old figure, in 2013, it was estimated that the global cost of managing dengue itself is about nearly $9 billion US dollar per year. And the age standardized incidence from the Institute for Health Metrics study was around 1,371 per 100,000 population. In Malaysia, in 2019, it was reported that we have around 131,000 cases. And of course, countries which have a bigger population like Vietnam and Philippines, they have a much more share of the number of cases. And mind you, when we are doing the study, and in the study was reported, these are the underreporting have to be taken care of. And we can see here that South Americans regions, as well as Southeast Asia and Asia Pacific itself, are the major areas that are affected by dengue. The latest figure in Malaysia, it was stated that up to 38 weeks epidemiology a week, we have around 40,000 cases with 24 deaths. If you compare with the previous years, there is a 117% increase in the cases that have been reported compared to 2020 and 2021. And overall, the incidence for Malaysia is much lower than what being estimated by the Institute of Health Metrics, which is 276 per 100,000, and with a case fatality rate of 0.06. These incidents are very important because when we're doing the study, we need to tackle the issues of underreporting. I managed to review papers which has been published in 3 countries close to us, Vietnam, Indonesia, as well as Malaysia itself, on the economic burden of dengue. In 2018, Hang et al. Measures the direct medical, direct non-medical, and also indirect costs. And from the societal perspective, using the average reported cases of nearly 90,000 per year, and assume symptomatic cases of 2.26 with a multiplier, it was estimated that in Vietnam, there are nearly about 40,000 Delhis were lost per year. And the cost is about 94.8 million per year, which comes from hospitalization and also outpatient costs. And hospitalization cost in Vietnam is around 3 times the outpatient cost per case, which is used in this calculation. Indonesia, with a population of nearly about 270 million, did a study back in 2015. It was published in 2019. They look at the hospital and clinic charges. And again, they look from the perspective of the society, where the indirect cost was actually being calculated. And in their study, actually, they focus on three major areas. I think Jakarta, Yogyakarta, and there is one more city which was actually included in the study. And from there, they extrapolate for the whole population. And a lot of direct and direct medical and direct non-medical are obtained actually from the admissions data that they use. And it was estimated that the outpatients visits was slightly more than 500,000, and they have nearly 898, close to 1 million inpatient admissions. And they calculated and reported that the cost per year of managing dengue is 381 million. And we can see again here that the inpatient cost is about 10 times higher than the outpatient cost in managing the cases. But of course, there are a lot more cases that were actually admitted in this, reported in the study. In 2019, Donald Shepherd and the team from University of Malaysia, they tried to estimate the cost of burden, the cost of managing dengue in Malaysia. And it was reported that per year, we will spend probably about 55.8 million. And slightly more than half come from the public expenditure. And the cost per capita for dengue is $2.03 US. And based on the study and costing data that they collect from UMMC, it was reported that the cost per admission is $219, and the cost of outpatient visit is only 10% of that. And we say 55.8 million per year is equivalent to 0.03% of GDP, and only about 0.18% of the total health expenditure for the whole country. In our data from our hospital in UKM, if we look at the cost of dengue per admission and also per outpatient visit, it ranges from 2,000 ringgit to as high as 3,000 ringgit, which is an average length of stay for a mild, moderate, and severe from 3.9 to 5 days. And the cost for outpatient visits in the HUKM hospital is 180 ringgit per visit. So this is quite actually significant, although the total cost is much lower than what we would expect. What are the prevention and control? Of course, many of the countries in the world, especially in developing countries, are focusing on looking at the vector itself. For example, prevention of mosquito breeding, which including the treatment on the, or action on the environment to prevent the mosquito from actually proliferating due to the egg-laying habitats, and also to use the screenings and to use the spraying. Yeah? Personal protection from house mosquito bite. This is another common mechanism where we give a lot of health education so that people will not purposely expose themselves to the mosquito bites. And I think in Malaysia, we do have a lot of activities involving community engagement, which we educate the community on the risks of mosquito-borne. And then there were a lot of campaigns that which was done continuously by the Public Health Division of Ministry of Health. And of course, the active mosquito and virus surveillance was carried out as a way to actually find out where are the hotspots, and action would be taken, especially with the community participation. But what about the cost effectiveness of the community intervention? There was a study which was very important that I would like to highlight here, which was carried out in Mexico, reported in 2017, where they did a study on looking at the intervention on community, the ultra low volume of spraying of insecticide. I think they were using some of the insecticide like perimetrin and all that. Combination intervention of community participation plus the pesticide spraying, and also the control group. The study was quite big, which involved about 582,000 inhabitants. And this is the result of the study. We can see that the cost for community participation is lowest compared to the spraying of insecticide, and also combination of both. And of course, in the control group is about 12,000. And if you look at the incidence, the likelihood to prevent and to reduce the incidence to nearly about 50% through the community participation and also ULV spraying. And if you look at the last column, which actually cost per deaths avoided, we can see that the lowest cost per deaths, which is actually the highest in terms of the cost effectiveness ratio, is the community participation in vector control. And of course, combination of both will not be that cost effective, about 10,000. This is, I think, below 1 GDP, which is quite highly cost effective. But of course, we do have vaccination program or vaccines that are available in the market. The Dengue vaccine, which was developed by commercial company Sanofi, licensed in 2015, and I think at the moment about 20 countries were licensed, have given the authority to do that. The issue with this vaccination is that in terms of the vaccine safety, which is the antibody-dependent enhancement, and that means that people who are actually seronegative might have a higher risk if they were to be vaccinated, and then after that they get infected with the vaccine. I think until this is sorted out, we need to actually look clearly about in more detail how the community would be able to accept this. And I think the changes that they make recently was actually not to give to people who are actually below 9 years of age, and followed by some catch-up program. But I think this is a major issue. Having that in mind, there were a number of studies, a number of countries which was actually being reported in the study conducted by Theng et al. With Donald Shepard. They did the study to look at the cost effectiveness in 5 Latin American countries and 5 ASEAN countries, including Malaysia. And the programs of vaccinations, those that are 9 years of age with a 2 kind of a catch-up, 4 years and also 8 years. In a model, they actually look at 30 years horizon with coverage of 80%, and the vaccine costs about $20, which is quite significant. And they look at the cost of illness, the vaccine wastages, and a lot of these are actually data were obtained from literature. The outcome, it was reported that both in Latin American countries and Asia, they will be able to, by having the vaccine, they will be able to reduce the direct and indirect costs as high as 1/5, by 22 to 23%. And which is equivalent to $8 to $10 per capita in a Latin American country, and much lower in Asian countries, between $4 to $5. If you look at the cost effectiveness ratio, looking at the cost per dailies, we can see that from health system perspective, the cost per dailies avoided is between 666 to 5,865, with an average of 4,002 in Latin America, and a bit lower in ASEAN countries, which is between 3,000, which is around 3,751. In Malaysia, it is one of the lowest, which is 1,935. All these are actually between 1 to 3 GDPs. In fact, in Malaysia, it is less than 1 GDP. This is from health system perspective. When the community perspective or the societal perspective we put in, where they calculate the loss of productivity, this is the situation using health system perspective. You can see that most of the countries are actually have below than 1 GDP, and Vietnam, Honduras, and Philippines between 1 to 3. None of it is actually above 3 GDP, which means all are cost effective. And Malaysia falls here with many ASEAN countries which considered to be highly cost effective. If you put in the societal perspective, you can see that countries like Brazil, Malaysia, and the average of the Latin America, you can see that many of these countries, 3 of these countries have got a negative ICR, which means that it is actually cost saving. And this is the very important findings. And many more countries are actually falls below 1 GDP per capita, which is highly cost effective. And only 3 countries are left with 1 to 3 GDP, which is Vietnam, Philippines, and Honduras. But having said that, we must be very careful about this study, because what it is not included is actually the cost of the pre-screening, which might be one of the things that we have to think about in order to increase the acceptance of this. But pre-screening itself is not that easy, because we need to find a proper ways to actually do the pre-screening, and in terms of sensitivity and specificity and the cost associated with that. So I will conclude that dengue is a major public health problem worldwide, especially in developing countries, of course. And the economic burden is quite substantial, especially in low and middle income countries. We know that community participation and also ULV spraying is quite cost effective, it's cheaper. and more affordable to control dengue. Dengue vaccine was proven to be cost effective, and even in Malaysia and few other countries were cost savings when we include the indirect costs from societal perspective. But again, we have to think about how to actually ensure that these vaccines are acceptable to the community, especially with the negative reports on the patient safety, especially related to the antibody dependent enhancement, which is one of the issues that might affect the users' acceptance. I think that I will stop here. Thank you so much for inviting me to share my views on this. Back to you, Dr. Zul.
Thank you, Prof. Syed. May I invite Kamran to introduce the next speaker, and we have question and answers at the end of it. Kamran, on yours.
Thank you very much, Dr. Ismail. Wonderful presentation. Warm welcome to everybody as well. My name is Kamran Rafiq. Thank you for the kind introduction, Zul, earlier. What a superb presentation to start this webinar off. Thank you for that, Professor Aljunied. We often hear there's not enough socioeconomic modelling. You mentioned Don Shepherd and this kind of cost effectiveness below 1% of the GDP line. So it's fascinating and very robust look at how cost effective this kind of uptake of vaccine is. And it kind of provides a very interesting segue into the policy side. So we're very kind of honoured to be joined today by Mr. Theng Kiat, who is the head at Prudential in terms of Chief Customer Officer. And you can see on the screen some of the bio there. More than 25 years of experience in terms of across different industries, bringing all of that to this particular sector. So we're very, very honoured that you're able to join us today, Mr. Go. And so I think that's enough from me, and we'll wait for the Q&A after. So I think I'll hand the floor over to yourself. So over to you, Mr. Go.
Thank you very much, Kamran. Good afternoon to everyone. I guess today I will start off my sharing with a personal story of I was personally a patient of dengue as well. This happened in 2020. Interestingly, that is the year of which the world was gripped by the start of the whole COVID pandemic that started off from Wuhan as well. So I could still remember very clearly that there was a day in June of which I woke up and I totally felt horrible, right? My body was aching. I was feeling a bit feverish. And the first thought, of course, at that point of time was, did I get COVID? I managed to get myself to the clinic. And thankfully, my very experienced GP looked at me and said that, hey, I don't think it's COVID. It could be dengue. And her suspicions in the end turned out to be right, because at that point of time when Singapore was grappling with COVID, there was also at the same time a peak, experiencing a peak in dengue cases in Singapore. So, what followed immediately after diagnosis was, and of course, I went through the proper blood tests to verify that I was indeed more dengue and not COVID. Was actually days and days after that of daily blood tests. Now, as if any of you have gone through a dengue experience before, would know what I mean. It was, in fact, a daily trip to the clinic to make sure that my platelet counts do not fall under a certain threshold, of which then it could actually become very dangerous, very fatal. And that's where I could not rest in the comfort of my home, and I would, in fact, need to be administered into a hospital. Thankfully, after I think only about 2 days of which there was a bit of a concern where my platelets counts continued to go down, it finally on the third day showed that the platelet counts had started to bounce up. And that's when the doctor said, okay, looks like you're fine, you could rest at home, but I would still need to continue my daily blood tests. I think all in all, I did about 5 days of the blood tests, and eventually I was then well enough to carry on my daily activities, of which the key symptoms of dengue, of which the heavy-headed feeling that I felt and the fever has gone away. Truly, I think those 5 days, I would describe it as horrible, as simple as that. It was really dragging me down. I just didn't feel like there's anything I could do. I was very fatigued. All I wanted to do was lie down in bed and rest. And even that rest was not a very good one because you're constantly feeling a very heavy head. And you feel so tired all the time. And thankfully, I had a very good care from my GP as well that finally got into it. But little did I know that that led on to a little bit of complications. So dengue as a patient is not so simple. It's not just that symptoms and having, making sure that your platelet counts is fine. But through my dengue infection, that actually has triggered an upsurge of 2 of my liver enzymes as well. I think the practitioner in this call will understand what I mean, because that is, as I understand, quite a common thing that has happened to some dengue patients as well. So you can imagine what that led into, right? So more tests to make sure that my liver enzymes, and that I was given proper medication to make sure that I could counter the upsurge of the 2 liver enzymes, which is the ALT and AST. And eventually, after a couple more days of monitoring and making sure that has gone down, where I was then really declared to be well. And that is actually important to control as well. So this is important to remember as a dengue patient, that it could affect, for example, your liver, and that could be very detrimental to the well-functioning of your liver for normal human body. So in reflecting back, I was very thankful that I was obviously employed by Prudential then. I was given proper employee benefits to handle all my medical fees. But I would imagine that for someone that perhaps may not have that cover, and you would have to come up with the cost of doing the test yourself, that could amount to quite a lot. And a simple blood test or daily blood test, each will cost about Singapore dollars, $70 if you do it in a GP clinic. It will cost maybe a little bit less, $60 in a polyclinic, which are those clinics run by the government. But you can imagine, like for myself, someone that has to go through 4 to 5 days of daily blood tests, that amount easily comes out to about $350. And that I have not included the additional tests that I needed to run on my liver as well for the 2 additional uptick in the enzymes indicators. So all in all, quite a huge cost to our customers, right? To any patients of dengue, if that has happened to them. And I think it's with that kind of consideration that we quickly went into action in 2020 and look into how we can help our customers. Because I guess in Prudential, one of the things that we live very strongly with is our corporate purpose of helping everyone get the most out of life. And that year in 2020, Singapore experienced one of the highest peak in dengue cases, right? Weekly cases. In fact, in July, the peak that we have ever experienced weekly was about 1,792 cases within the week, right? 1,792 cases within the week. All in all, I think there are about 35,900 over cases in the year for 2020. And a few reasons, key contributor was in some ways related to COVID. Because of the surge in COVID cases, the Singapore government in April 7, 2020, declared what is known as circuit breaker, right? Or in other countries, for example, I think Malaysia is called MCO, right? Control order and so on. So in Singapore, it's called circuit breaker. And because of that, more people stayed at home. And when they stayed at home, where perhaps they're under more natural ventilation and not in the office air conditioning environment, there's more contact with mosquitoes. That's one key reason. The second key reason is because of circuit breaker, that window itself, a lot of economic activities were stopped, including construction activities. So a lot of the construction activities were in fact suspended. No one was taking care of construction sites, and therefore that led to a higher accumulation of water, right? And we all know water is a breeding ground for mosquitoes. The third reason was also the upkeep of general landscaping in Singapore. I guess it's a good thing that Singapore is known as a green city. We have lots of trees, plants, bushes along. But during that period of time, evidently a lot of the landscaping was not well taken care of as well. And that again became more breeding grounds for mosquitoes. So I think it's a combination of all these different reasons that led to such a high incidence of dengue cases in 2020 for Singapore. And that really kicked us in Prudential into action. And then I think maybe at this point of time, I will just show some slides to talk a bit more about, as a company, what do we try to help our customers. Just a second on that. I hope you can all see my slides. Yeah, great. Okay, I see Kamran giving me a thumbs up. So what we have done is to try to understand the incidents that happen to our customers, how we can help them. Cost is one thing. How can we help them with some immediate relief financially if they encounter dengue? That's one. Two is, how do we make the product easy to access so that given that dengue on a normal basis is quite seasonal, how do we make it affordable and accessible such that they're able to give themselves some level of insurance protection if they are ever hit or contracted by dengue? A second. Okay. Yeah. Okay. So that's the kind of experience that we have gone through. We want to pretty much set out to develop a product that can be affordable by the customers, easily accessible. At the same time, not just that, right? The fact that a lot of mobility was very difficult during that period of time, as we can imagine, because during a circuit breaker period, nobody can move freely to another locations. Visitation to places are also more difficult. Of course, you can visit clinic, but there's also a generic, evident fear of going to a clinic where there could be COVID patients and all these different considerations, right, at that point of time, that we want to make sure that this product is also easy to enroll and easy to purchase. What we also find out that not all patients of dengue need to be hospitalized, thankfully for myself, as an example. And from our own claim history, our own historic incidence rate, we also found out that roughly about 35% needs to be hospitalized. And when that happens, there's also recurring costs when they are being hospitalized. So based on some of these insights that we have gathered from patients and from experience, what we are seeing from the market, this is where we thought of a simple product that could help customers with an immediate one-time lump sum once they are diagnosed with dengue, $500, right? So I'm kind of using my own experience, right, to share where this could help quite quickly with some of the patients. As I said, a blood test in a clinic costs about $70. Easily, you need to do 4 to 5 days of continuous daily testing. That comes up to close to $300, $350. This lump sum payout will be welcomed by our customers. And the confirmation can be made by the NS1 dengue antigen test or the dengue serology test, right? Very easily, that is available in the clinic. Once they get that, they tested, they can file a claim, they're able to get this lump sum payment straight away. At the same time, we also think about hospitalization for the more serious cases of which they need hospital care because of possibly very low platelet counts, and they need to get more care from the hospital. The patient itself under this product will get $200 per day, up to a maximum of about 5 days, right, when they're hospitalized. This again provide them daily care to help them with any kind of financial help if they are unable to work. Right? Take for example, some of the patients could be on daily wage, for example, or on gig works. Once they are sick, they are down, there's no income. So again, we are thinking about such financial relief on a daily basis that will again help them financially when they are down with dengue. Last but not least, we also thought about the worst. How do we help families of which the worst case happened? And definitely we don't wish this to happen to any of our customer or patient. But if complexity comes in because of dengue and that resulted in a unfortunate death, we will also pay out for this patient, for this product, 20,000 death benefit to give the family some form of help and support during this difficult time. Okay, so imagine with all this benefit, what we want to do is really make it easy for customers to purchase and also affordable. So this product that we launched eventually in December 2020 costs only $5. Only $5 for the patient, all right? It's in some ways what is known within the insurance industry as microinsurance, very easy to purchase. We also know that the concerns on dengue, well, it does happen regularly in that sense, if not for a unique year like 2020 where there's a high peak. Usually that happens, but there's also seasonal peaks that happen because of perhaps that period of time there's more rain, there's more accumulation of water, more mosquito breeding. And we wanted to, at the same time, balance out the affordability with the relevance of the product during that period of time, have the product for the 3 months coverage for just $5, right? So that's the thinking behind the design of the product. So when we launched that is the lowest price dengue coverage that's available in Singapore. And again, to help customers access to it without the need to visit a clinic or need to visit an insurance agent, we made it available through our digital platform, an app which is known as Pulse by Prudential, which is available not just in Singapore, but in 12 markets in Asia itself. And in a lot of the countries that's been spoken about by Prof. Syed just now, the app is also available, including, for example, Malaysia, Indonesia, Thailand, Philippines, and so on. All right. So that makes it easy for customers to download the app and then buy through the app itself, a certain section known as Pru Shop, where we have other micro insurance products in there as well. It is, firstly, the app is free to download, and the app, besides providing micro insurance, also provides other health and wealth features to help our customers get the most out of life, right? Whether it is to help them with without the need to visit a clinic, a teleconsultation, straight away by video, get a doctor consultation that's available through the app, or also assessing their own health risks through some partnership that we have done that's delivered through the app. This health risk assessment that we have within the app, or a symptom checker that they can use it. And it's quite interesting, the symptom checker. When I was initially ill, I actually used a symptom checker to find out what could possibly be my issue as well. What the symptom checker does is it doesn't give you a diagnosis because it's not supposed to, but through its triage, gives you a recommendation of what to do, whether you should immediately go and see a doctor, you should just rest, or get yourself to a hospital very quickly. So these are some of the features that's available through the health portion of the app itself. So back to the product. So no underwriting is needed for this product. Simple, a couple of clicks, and you can pay through a credit or debit card, and $5 will be taken off from the card, and you will be covered for 3 months. And after that, you can easily renew again on the app itself. So as I said, such bite-sized dengue products is available through the app in a lot of countries, including Malaysia, Indonesia, Thailand, Philippines, and Cambodia. So that's pretty much the whole experience that I had with dengue itself. The rest of the information I will just talk through very quickly. In fact, some of them have talked about it, which is how do we make the product very accessible to the customers, which is using an app in the phone. As we all know, we all live by our mobile right now, right? The mobile penetration across many countries in Southeast Asia and in Asia is tremendous. In Singapore itself, there is a 1.57 index to every individual in Singapore, which means averagely one person holds about 1.5 mobile phones. So the mobile penetration is so high that we thought driving this through the app is the easiest way for us and for our customers to be covered, right? Okay, the rest of it, maybe I don't need to talk too much about it. So other bite-sized products that we have besides dengue, even though I know this is pretty much a dengue voice and action forum, but we try to include microinsurance products that can help customers be covered at a very affordable range, whether it is very specific even cancer cover. For example, we cover using Prusave prostate cancer and Prusave breast cancer, very specific cancer coverage for male and female. Because of COVID, we also provide complementary cover for any adverse effects because of COVID vaccination, because we are in total support of Singapore government's vaccination program against COVID. And we do know that there's this fear of the adverse effect around COVID, and we provided this cover complimentary to anybody who download the app, such that if they ever get into any adverse effect as defined by MOH because of vaccination for COVID, they will be covered. Their cost will be covered by this free product, right? So there are other things that we included as well. And most recently, we launched one to help very active customers of ours who are engaged in sports into simple coverage when they get into any kind of injuries because of sports-related activities. All right, so these are some of the bite-sized products that we have in Pulse by Prudential. The rest of it, I think I've gone through it, more of the features that we have for for health and wellness within Pulse, the app itself. As an example of how we work with such diseases and how we work with the ministry on this, definitely we work hand in hand as an insurer with the Ministry of Health on this. Prudential is one of the 7 providers of a supplementary insurance product to the national insurance program that we have known as MediShield. We are one of the 7 insurers provider that provide what we know as integrated shield plan. So that's one. For COVID itself, a lot of things that we are doing are in line and in support of the government action to ensure that the nation is well defended against this pandemic that has still ravaged on for 3 years. Firstly, our medical products cover our customers against any COVID medical cost that's needed. So i.e., for example, our PruShield, which is our integrated shield plan, covers that. Our employee benefits group insurance product as well covers any hospitalization, any medical care needs for COVID. We also work very, very closely with association, which is in Singapore, the Life Insurance Association, for anything that is needed to collectively as an industry in our fight against key diseases, for example, COVID itself. All right. So I think I'll very much conclude here. Hopefully my sharing of personal stories give you a bit of context why Prudential think this is an important product for us to launch in 2020, and the thinking behind the way we design our product in terms of its cost, in terms of the duration of which coverage, in terms of the benefits that we roll out as part of the product for our customers and for any patients that are, or for anybody that's fearful of contracting dengue at this period of time. And I just add that I think this whole upsurge in dengue cases in Singapore, in the end, in 2020 was not an isolated case. Because interestingly, like what the figures that Prof. Syed mentioned of Malaysia this year, Singapore is actually experiencing a surge, a peak in dengue cases this year in 2022 as well, right? So year to date, by end of October, we already have 29,000 cases compared to about 5,000 cases in 2021. So we are almost on par this year to the number of cases that we had in 2020, right? And that was very much driven by all the reasons I mentioned just now. Shut down the economy, everybody staying at home, circuit breaker period, and so on. While Singapore right now, as you all know, the economy is open, everybody's free or going back to the office to work. But despite that, there's still an upsurge. Hence, this product is still relevant. So I shall kind of conclude here. I'll pass it back to Kamran.
Thank you very much for that. Fantastic presentation. Real eye-opener in terms of, on many, many levels. There's a lot to unpack there in terms of the actual, your involvement, your engagement with communities. Very interesting, you talk about the penetration stats of mobile phones, i.e. highly sociable, highly mobile communities, which have been affected not just by dengue, but with COVID as well. So there are a few questions, and some questions are coming through from the audience. Professor Ismail, should we start with yourself? Do you have questions to start with, or how is that a better way of doing it?
Yeah, I think, I don't know whether there are any questions now. Those who have questions, I think you can type in chat box. But it's interesting that what Mr. Goh mentioned about Singapore having a peak in 2020. We actually had a webinar during that time, and we got reports from countries like Sri Lanka, Indonesia, and Malaysia. And all of these other countries actually showed a dip in dengue cases during the pandemic. And it was only Singapore. We also had Singapore presenting, and Singapore is the only country that showed an increase in dengue during that pandemic. So it was an interesting thing that we actually uncovered during the whole sessions that we had. So if you have any questions, if you could just type the questions on the chat box, and then Kamran will read them out, because I'm on my phone.
I had one question as well, and I want to ask go about this. And I think somebody's actually put that question in a roundabout way. An anonymous attendee has just put it in there as well. My question was going to be about this, that in dengue, just concentrating on dengue for a second, we often hear from our perspective talk about preparedness, resilience being brought into national level. And from the dengue perspective, at the moment, that's been a lot. It's through the lens of, let's say, next generation sequencing, being able to sequence a sequence, produce a PCR, produce a vaccine candidate. So resilience and preparedness on that level. In fact, in Singapore, I was in Singapore just for the ADS a few months ago, where the Duke National University had put forward a kind of a center, launched a center for arboviral research. What I wanted to ask you was, from what you've explained of dengue and your the Prudential approach, how far are you going to in terms of redefining resilience, redefining preparedness by giving the populace an option to be covered financially when they get hit with dengue? I'd like to ask that to Mr. Theng Kiat first, if that's possible.
Well, I think firstly, as an organization, we are always supportive of what the government measures are. And I think the last 2.5 years of going through the pandemic is a great experience as an organization, how we can work very closely to manage and control certain diseases. And I think nothing gets bigger than COVID in the last few years in my own recent memory. And even despite this being such disruptive pandemic, as I will call it, most governments, including Singapore, has not made vaccination mandatory, right? It has not, right? It's still voluntary. And hence, I think our approach, together with the other players within LIA, the Life Insurance Association, is in support of those who have chosen to be vaccinated. And if they are, for example, like some of the measures that we have done, including providing a complementary cover for any adverse effects to vaccination, is what we would probably do. And that was what we did COVID, right? So then flipping that question to your question, how do we make it more resilient for the nation? Firstly, I think I may need to put that question to policy makers. Yeah. Now, how are they going to approach the whole vaccination program? Because evidently there are members in the population. I'm a parent before. I've gone through many discussions with fellow parents about vaccination for kids. There's always a concern. And when this vaccination came about for COVID, there are also members in the public that are concerned about vaccination. So therefore, the government, I guess, wisely has always been more encouraging for people to take it and not making it mandatory.
I was just, before we come back to that, I was about to say thank you for the answer and flip that question to Professor Aljunied. You mentioned policymakers, Mr. Goh, there. What's the lingua franca, Professor Aljunied? How do you turn on a policymaker? By that, what I'm trying to ask here is that a lot of these policymakers we're talking about at government level are looking and talking about universal healthcare as the end point. I'm sure you've covered this. You've had a very interesting look at cost effectiveness in your presentation, and mentioned Shepherd, Professor Don Shepherd, the papers with Yang et al., and the Mexico paper with Mendoza et al., and everything. And in some of those, you'd mentioned that below 1% GDP is the kind of sweet spot, and below that, you're actually cost saving. It's negative. You're actually saving costs at national level. What is the language we need to put all of this to the policymaker? Will they understand the insurance language? Will they understand the economics language? What will cause them to change policy towards this in terms of taking on vaccination?
Yeah, thank you for posing this question regarding what are the actions, or how can we influence policymakers if we want to. Actually, what is available as data at the moment, I just want to make some correction. It is not 1% of GDP, it is 1 times GDP. It's not 1%. So, and WHO to a certain extent requires give a guideline that anything below 3 GDPs are considered to be cost effective. It is below 1 GDP is considered to be highly cost effective. But again, if you look at the study that I have reviewed, there are a number of issues that we need to actually expand further if we are thinking about asking the government to consider vaccination as one of the options. One thing is that although it is cost effective, the intervention by the vaccine, by putting aside the issue of the ADE, which is an important factor in the community, there's also issue of affordability. For 1 dose is $20 is quite expensive compared to the current vaccine which are available in the EPI program. So I think we need to sort it out. Even if it is proven to be cost effective, many countries, especially developing countries, may not be able to afford it. So that's why the next step after the cost effective analysis, even if it's shown that it's highly cost effective, we need to do the budget impact analysis. And when we do the budget impact analysis, we need to compare in terms of the amount of resources that we have to put in using other alternatives. For example, the public health programs targeting the community, for example. And I suspect, although I don't think there is a budget impact analysis has been done comparing the vaccine with the community intervention, I suspect that the community intervention is much cheaper and affordable compared to the vaccine costs of $20. I think budget impact analysis is a very important aspect that we need to consider. And remember that cost effectiveness ratio is only one of the things that the policymakers might want to digest before they decide to move in. And of course, then we will come across more important issues like, for example, if the government purchased the vaccine, how much that we need to do the campaign in order to get this community to accept it. We already have a lot of experience when dealing with the COVID-19 vaccine, although COVID-19 vaccine has nothing to do with ADE, and they are much more safer compared to other vaccine. But with this important aspect, it is quite difficult. Even if the vaccine costs have come down, but the cost of campaign and all that might actually bring up. And if you look at the total cost of vaccines, total cost of dengue itself, it is quite low. It's only about 0.18% of our MOH budget. And of course, then the government might think about why you want to vaccinate people if you can do cheaply by having community intervention. So this is something that we have to think about. It is not that straightforward. It is not does not mean that if it is less than 1 GDP, we should actually hang on to that. It's a different scenario compared to COVID-19 because the volume of the cases in COVID-19 is much more, and the cost of treating COVID-19 is much, much higher than what we can see in terms of dengue. And then, of course, the case fatality rate will also be very high. So all this have to be sort of properly assessed. Although, if we have the opportunity to have a primary prevention using vaccination program that are effective and safe, I would go for that. But then we have to make sure that we provide a proper comparison, and this need to be done. As far as I know, until today, the current vaccine have not been able to run away from the issue of ADE. Unless there's a new vaccine that being introduced where the ADE has been settled, then it's okay. I think what the manufacturer did now is just to shift the age from 2 years to slightly older age group, so that hopefully that these people, these children have already been exposed to vaccine before. I think there are still quite a lot of challenges that we need to face. We need to actually settle before we can work with the policymakers and confidently suggest it to them. Honestly, at this moment, as a health economist, I'm not that convinced to actually push forward for the vaccine to be one of the options, unless I'll be able to do a study to look at other options, other type of vaccine which is safer. And also, we will do the budget impact analysis to see what is the real commitment of the government that can be safe if we were to do vaccination versus the current public health intervention.
Thank you very much for that.
There are new vaccines coming up from Takeda, also MSD. I think we're waiting for the details of that. There's a question here for Prof. Syed from an anonymous. It says, can you please highlight on the comparisons of ICER when they are at the area of cost effectiveness, positive value, and that of saving, which is negative value? What's the difference between from the perspective of health policymakers, government leaders, researchers? He needs a bit more explanation on this. Can you do that, Prof. Syed?
Yeah. I mean, okay, let me just put it simply. I think when we are looking at the ICER, it comes to a situation what we call the ICER plane, where we are looking at intervention, the effectiveness versus cost. Most of the intervention new intervention are normally is costly than the existing intervention, but it's also effective. That's why we need to know the level of effectiveness and the ICER ratio. And WHO have said that when we are dealing with the denominator, it can be, say, for example, life years of save, or dailies, or QALYs, which is more favored by many of the economists, but now dailies is available. So cost per dailies, anything below 3 GDP is considered to be cost effective and should be implemented. But if it is below 1 GDP, so these are what we call the in the cost effectiveness plane, it falls under the quadrant 1. But when we say cost saving, it means that you see the graph which I showed in my paper before. Whenever we put in more costs related to the loss of productivity, which can be saved as a result of prevention of having COVID-19, you can see that it is not only cheaper, but also it is effective. So it shows that the cost effectiveness ratio now, the cost of the vaccination is much cheaper than not doing anything else. So that's why the results is negative. So if it goes down below what we call the quadrant number 2, which means that for every intervention that for every time that we provide the vaccine, there will be cost saving to the government. That's why the result is negative, because the cost of the vaccination program is actually cheaper than the cost of treating the disease itself. So if you look at the formula, intervention versus non-intervention, that's why the results is negative. When we come into that, this is very ideal, because this is very good. There's no way that we can actually just brush off the vaccine. But again, my issue is that in that particular model, we have not put in other things. One of the things that we have not put in clearly is, number 1 is the ADE cost. And I think this need to be in that particular study. I think in the new studies, if they were to rerun the study, they should put that into the picture. But of course, if the incident is very, very low, it may not change much because the cost saving as a result of the prevention from loss of productivity due to admission, due to time people have to commute to the hospitals, which is actually the part of the societal cost, might be very significant in that sense. So I think in short, this is how we viewed it. very rarely actually you will see the cost saving situation in doing the cost effectiveness analysis. And this is quite good from the study, but there are some weaknesses of the study that need to be improved.
Right.
I hope that I can explain that more clearly here.
That's a great answer.
Any other questions, Kamran? Is Mr. Go still with us?
Yeah.
Yes, I'm back.
I think
I'm
Mr.
back.
Go's
I'm so
still there.
sorry. The connection
No, that-
sort of went off just now. I'm so sorry.
Okay,
That's
so
fine.
there's a question here for Mr. Go. It says, will insurance companies consider covering dengue vaccines for the consumers? As we know, there are new vaccines coming in the future.
Well, I think firstly, insurance, it depends on what kind of insurance we talk about, right? There are so many different categories of insurance. If we talk about medical insurance, we typically cover the cost of the treatment, not necessarily the cost of the vaccination itself. So again, using the COVID example, it is the complementary insurance that we do give treats the or rather covers the cost of treatment if there is any medical care needed as a result of the vaccination, but not the cost of the vaccination itself. I wouldn't say this will be the case. It all depends on the environment or the situation then, right? To see how we can again guided very much by what the government intends to do, and at the same time guided by how much we can help our customers if that it becomes a perverse case that's happening within the market.
There's a question about from somebody who asked about most insurance will actually cover for admissions only. So, but you showed us that it covers dengue. If you get infected, all you have to do is show the NS1 result. You want to comment on that?
Yeah, I think that's where we thought that is a pocket of area of which customers can be helped in that area, because we know that not a lot of insurance covers that, right? Or they could be very, very costly, right? Take for example, most insurers will have a personal accident product that in Singapore typically costs about $170 a year, right? But of course, admittedly, it covers a wide range of different products, including treatment for dengue, right? That actually covers both inpatient and outpatient for the Prudential product that we talk about, all right? But it is about $175. And when we consider the product that we talk about, which is PruSafe Dengue, as I mentioned just now, is a 3 months coverage for $5. That's about $20 a year. And you can choose the period of time that you feel you are most at risk, right? Whether you are living in an environment of which there is a huge cluster of dengue incidents, and then you feel that there's a need to perhaps provide yourself the kind of cover with a simple $5. Yeah.
All right, thank you.
If I could just ask if I could just come in for 1 second. Both of you, Professor Aljunied and Mr. Go, you both mentioned the importance of community engagement at some level in terms of your presentations. So just coming to that as an area, it's coming out of vaccines for a second, just to ask about that. I don't know if you're aware, Professor Aljunied, but just last year, or I think 2 years ago, it finished last year, Bayer Vector Control had a very large RCT, randomized control trial in Malaysia, looking at community engagement, netting, new insecticides, rather a massive piece of work there, and they clearly demonstrated the importance of community engagement. Well, I suppose what I wanted to ask you, and I suppose so the first question is actually to Mr. Go. You mentioned, just to come out of dengue for a second, you mentioned pulse in part of your presentation. And when we last spoke, you had a fintech a meeting when we had the rehearsal of this, I think last week. So obviously tech is affecting this area. The new kind of iterations of tech are affecting all sectors. How do you view pulse moving forward? Do you think you're going to include more and more diseases on that? Are you just going to stay with that, with a few of those micro products on that? How do you view pulse and community engagement? So that's a question for Mr. Go firstly.
I think again we are guided by our corporate purpose, right? If there is a need and there's a strong need, and definitely where the market is lacking of products that help it, we will be very, very interested to provide that care. Using tech is definitely one of the ways of which we want to engage our community. Take for example, we apply all forms of tech, right, as and when they are relevant. Even simple tech like geolocation. So when we actually have the product available on house, we actually use geolocation as well to target customers who are within the red hot zones for dengue clusters, to raise awareness that, hey, you could be in a red hot zone as defined by the weekly numbers that are shown off by the ministry and by the NEA, the National Environmental Agency. Because we do have very good tracking of where the red clusters are for dengue cases. And that's when the message goes to and say, hey, this thing is happening near your area. Would you want to consider yourself to be protected? So such simple technologies are definitely used to engage the customers as and when they are relevant. And Pulse is an effective app because it is in a phone, right? Everybody has a phone, or most people have a phone these days. And definitely we'll look at ways of which, if there's a need, leverage that to reach out to our customers a lot more.
Excellent. Great answer. And thank you for that. If I could swap that over to Professor Aljunied, in terms of your perspective, you mentioned productivity and community or that kind of thing. What other optics do you have on community? You're showing that it works when you combine community engagement into this kind of cost effectiveness, the various studies that you kind of pulled apart there. What's your view on community engagement from a health economist? How important is that community to all of this?
Well, being a public health physician, to start with, I think we work with communities and we believe that a community can do a lot more in trying to control this issue, but it's very challenging. One of the issues that we are facing now is climate change. So even if we try to get the community to cooperate to reduce the breeding grounds and also to clean the environment and all that, there are issues related to climate change that the mosquitoes become resistant to the pesticides. And remember that we are trying to a study which was supposed to create the mosquitoes that are sterile, but we haven't heard about it at the moment. How much success is there actually with that particular project, although there were a lot of issues on safety again regarding this. So if we have a good and effective vaccine, that is the ideal approach. But again, a issue of affordability and all that. Having said that, in countries where we don't have enough resources, I think community engagement is still one of the important aspects. But the challenge is that the approach that we do today of giving education to people, tell about what they're supposed to do, may not be enough. People need to be guided more to make sure that it is effective. I just want to comment a bit more when we from what Mr. Goh has already discussed regarding the private insurance. I have a bit different views on the role of private insurance, especially as you know that I'm the advocate for social health insurance in many countries that I work. So I'm not against just Prudential, but many other private insurance because if we are talking about a dengue itself, we must remember that people who suffer from dengue, especially the serious conditions and also those who actually succumb to that, are those with multiple complications. There are people who already have chronic non-communicable diseases and all that. And in many private insurance, what they do, they actually exclude these people from the outset. So you take only people by low risk. And when doctors make diagnosis, when a patient come in with, for example, dengue, I do a lot of case meet. Dr. Zul knows about that. Yeah. When we talk about the severity level 2, severity level 3, these are the people who actually suffer from complications like septicemia. Maybe they have issues related to congestive heart failure. And when these come in, will these be rejected on when it is going to be claimed at the private insurance? Many private insurance in developing countries obtain their resources by actually delaying the claim or actually reject the claim. when you want to purchase it, it's very nice. But when you look at the detail of that, so what happens when the patient suffer from chronic renal failure, which is superimposed on patient with dengue? Are you going to cover that? This is the challenges. And if you are talking about $200 US per $200 US per admission, that is not going to be enough. So again, it might be a good product, but we have to read the detail of it. And I'm still concerned about the so-called the moral hazards of the insurance agencies when it comes to implementing this. We have seen this in countries like Indonesia, which is the biggest country in the world that runs social health insurance program. And the people are depending on the government rather than the government insurance rather than the private insurance. So I'm a bit critical on this, but this is the situation that people must know. And I think we should not actually push this product without telling them what is the consequences of doing that.
Should I to respond to that, Mr. Go?
Yeah, exactly. I was going to say, yeah, Mr. Go.
Well, firstly, I guess the point that's brought up by Professor Syed is relevant in the sense that when it comes to insurance coverage, that it can be quite complex, right? Because how a person is in the end affected could be due to multiple different cases. We do look at cases fairly and individually to make sure that we give a fair assessment to the claims that are being made. I understand where Professor Syed is mentioning. What we would usually do for such cases to make sure that on the onset of the point at which the product is being purchased, we make it as clear as possible to the customer. One thing about this product is, as I mentioned, there is no underwriting. So at the onset, there is no exclusion. However, he is also right that perhaps at the claim stage, there could be other issues that pop out that may actually lead to the exclusion of the claim. But I think those are the cases of which it's hard to comment in general, right? It is down to the individual cases of which we do examine very closely to make sure that we give a fair assessment to the customer.
That's a good reply. If I can just ask one last question. Thank you both for those answers. You both mentioned COVID in your presentations as well. I suppose it's quite a general question, really. How have you found the COVIDization, in brackets, of this particular space? Have you had more uptake since, I think, December 2020, Mr. Go, in terms of this particular product, or the usage of Pulse, or the kind of engagement from a customer level post-COVID? Are they more aware now of people more? How do you feel about that? What's your view on that post-COVID? Or I say post-COVID, the backdrop is still there, but how do you feel since the launch in 2020 to now? How have the effects of that been on that kind of product and that kind of approach?
The products still continue to be well received. I would think that, again, it plays to a lot of the media attention given to it and how much awareness it is. Definitely, 2020 was a bit of a year of which everybody pays a lot of attention to what is affecting them on the health basis, right? Whether it's COVID or in Singapore, having just heard that Singapore was in fact quite a rare, unique case in 2020 of having such a upsurge in dengue. There was a lot of attention on it. This year, I think the media attention and individual attention, public attention, is on a lot more other things. As we all know, there's a wider concern around the inflation, economy, and so on. But despite that, this product still continue to be well received. I wouldn't say it is more than 2020, but it is equivalent.
Okay, that's a great answer. Professor Aljunied, in terms of your perspective, COVID's obviously, are the policymakers more receptive to your kind of arguments in terms of cost effectiveness, productivity, effects on productivity, all of these kind of things? Are they more receptive now?
Well, generally, it's very difficult to see, especially now we are in the midst of a oncoming election. We do not know the sentiments and also the issues that are going to be addressed by the policy. Is there any money left or not to actually embark on new vaccination program? So after we spend quite a lot on on COVID, and now COVID is having another go that we need to be careful about it. And I think that there was already availability of the bivalent vaccine currently for COVID, which is actually quite interesting to look at it. I think we need to build up. I think the Ministry of Health, through its mechanisms, are actually tightening the mechanisms to actually introduce any intervention. They must be exposed to a proper health technology assessment, apart from cost-effective learning, which is much more organized now. But a series of studies has to be done to prove that it is really value for money, and comparing with the other things. I'm very interested to see if the new vaccines that are being launched will have the issues ADA being settled. If that is being settled, then it will be good. If you look at there is a Q&A question by Q&A remarks by one of the participants. They were asking about the insurance in Malaysia. I think it stated that people who suffer from dengue, because infectious and public health important diseases, it is given free. What is the role of the insurance, private insurance? I think from my perspective, I feel that those who do not want to use the public facilities, if they want to go to private healthcare, they might want to actually use the private insurance. This is quite common even in countries where we have a social insurance program. In Malaysia, for example, if you want to reduce the waiting list and also waiting time in the public facilities, then I think the private insurance might provide a conduit for them to actually do that. But again, having said that, we have to think about whether the coverage will be adequate or not to cover, especially if they go into a very serious condition that I mentioned earlier on. Yeah, I think that's my views here.
Excellent. Thank you very much for that. Dr. Zul,
Cameron, you got any other questions?
I'm just trying to open the chat. I'm actually trying to just open the chat box. Actually, these are my own questions at the moment. There are quite a few questions in the chat box that I've just come across now.
Yeah.
And I was just trying to quickly scan through those. I think you just mentioned one, Professor, as well. I think you were relating to the Professor Ahmed Al-Qudari's question at the end of that chat box. I assume that's the question you were talking about. Zul, over to you. If you've got anything you want to add to that, it's up to you.
No, I think there are some questions that have been answered by the speakers themselves. So if you go to the Q&A box, the answers have already been written up. So I don't think there's anything here that we need to highlight. Any other questions from the ones that have been answered? They're quite general questions. Any other issues that we want to cover before we end this session today?
Yeah, that's fine. I was going to ask just quite a general question really about education. This is more to Mr. Go, which is why I was trying to bring Pulse into the proceedings somewhat. It seems like a superb landing kind of site for an app for the community to not just understand when they should get the product or what's happening with dengue, but actually to educate them as well. Do you have any plans about kind of, I'm not saying revamp, but really boosting that? That's a very interesting interface for the community. It's an app, they're using it. You've got a very large potential there to educate them on transmission, vector control activities, all of that. And before we even get to the sharing of data from that, what are the plans on that? This is what I was trying to speak about with Pulse. So over to you.
Yeah, we're definitely looking at ways to improve the app in content and in features that will help our customers. So speaking about, to your point about how else can we use that platform to educate, there are contents in the app itself. So it's not just features that you can use as what I described just now. There are also contents, articles written on different aspects on health that's needed. For example, diseases or fitness, diets, and so on. And on the money matter, on the wealth matter, there are also contents around financial planning. What's the best way to think about retirement? How do you set goals? When do you need help to set goals and plan towards that? So all these contents are available on the app. Definitely, this is one of a key initiative, strategic initiative for Prudential, and we will definitely continue to drive it in terms of awareness, in terms of reach among our customers and the public as well. Yeah,
that's a brilliant answer, and thank you for that. I mean, we talk here. I'm joining you from London here, so and I understand that. I think Professor Aljunied made the point in the last call we had that every country's got its own nuances and different health systems and different structure. We totally appreciate that. What I was going to say is, how far will this rollout go? I mean, this is back to Mr. Go. You mentioned, I think, 12 countries, and I think it's from what we see, superb, brilliant presentation, and it really needed intervention. How big do you think this is going to go? Remember that dengue is now across over 120 countries. Just now, Europe has had its own ototoxinous cases. France, Italy, Madeira already, the island of Portugal, Spain. This live here, different vector, the albopictus vector, not the Aedes aegypti. However, it's happening here. What are your views on that in terms of expanding pulse, the footprint of Prudential?
Well, as a business, Prudential is highly focused on Asia and Africa. The plan is to ensure that we have the app serving the needs of the customer in all the markets that we are in, right? So definitely the plan is to make sure that this app goes out to, at this moment as we stand, the 8 African cities that we are in, or 8 African countries we are in, and the 12 Asian markets that we are in, right? So they are slowly getting into the African markets as well, where Prudential has representation, right? And definitely, I think in those African markets, which include Nigeria, Uganda, and so on, the whole concern around dengue and any other diseases will also be critical. And that's where possibly this app and the content and the features could help.
Yeah, that's a fantastic answer. Very encouraging to hear. I mean, diagnosis of febrile illness in Africa is a big, problem, big gap, which needs to be looked at. That's anything that can help post-diagnosis are going to be very well received. So that's brilliant. That's an excellent answer. Dr. Zulkifli, do you have, I think you've just typed something on the box, or you've written something about you'd like to answer this question live. So I don't want to steal your thunder, but...
there are 2 questions here, 2 clinical questions, which are not really related to topics that we discussed. One is on somebody who read that dengue vaccine has been recalled due to safety issues. Is that true? Well, it's still being used, I think, in Brazil, and it's still being used in some private sectors in Singapore, but it's not being used in the Philippines. And the next question is, do you encounter COVID patient with positive dengue IgG, but clinically it's more of COVID? If I have this kind of patient with an IgG positive, it means it's an old infection. I would treat it as COVID and make sure that he's actually COVID negative, or COVID positive, we treat it as COVID. I think that's all the questions that we have had to. There's a question about, is the app available to the public here? To Mr. Go, is it available?
Yes, it is. The app is available to the public, so you don't have to be a Prudential customer to use it. But definitely as customer, you do get other features that will help you understand your policies and your portfolio a bit better.
Okay, here's one on equity. Lower income communities suffer disproportionately the burden of dengue. So do you believe that these insurance schemes will reach the lower income population?
As I have mentioned earlier, that's the whole...
$5.
Yeah, $5. That's the whole design of it, right? So that hopefully with $5, they're able to cover them for 3 months adequately for any issues that they may pertain once they contract dengue.
Okay, Kamran, do you see any other questions that we've missed?
I don't think we've missed any. From what I can read, I think we've kind of asked those questions ourselves in a roundabout way. It's kind of there. There are a lot of thanks in there as well from people as well. So I think the questions
Kamran,
have been asked.
There is one question from the anonymous attendee regarding the false security of people who get the vaccine. Can you see that question?
I'm just trying to bring that up. Sorry, it's a question of the anonymous. Do you mean the false sense of security? This question? Yeah, I've just got that now. So I'll just read that out for you. So somebody has kindly put in, and there's no need to be anonymous. You should have put your name as well, but no, never mind. Anonymous attendee is saying, just an interesting thought. Could dengue vaccination or even insurance coverage create a false sense of security amongst the community, leading to the alteration and changes of health behavior and lifestyle? They may not be bothered so much about the conventional vector control measures, keeping the environment clean, etc. So is there a danger that we're going to, just by giving an insurance product, create a false sense of security amongst the community? Mr. Go, to you.
Well, let me start first. I think from the perspective of an insurer, definitely that's not our intention, and that's not meant to be, because the insurance products helps in terms of financial support when they are infected with dengue. In fact, when we launched the product, we accompany it with many of articles and content that helps customers understand what are the ways for them to protect themselves against getting dengue. All the measures that has been mentioned by the person that actually posed the question about taking care of their environment, making sure they throw away still water that's in the environment or at their home. So all these articles are also part of things that we actually launch in a company with the product itself.
I think that's a very interesting answer. I mean, you've mentioned we've talked about Pulse and the phone and the highly sociable, highly mobile communities that are out there. We had a panel about a year and a half ago at UNGA 75, 2 years ago at the United Nations, and it had the Ministry of Health Malaysia, Dr. Rosuddin was on there, but from a vector control perspective. And I asked the question that, has COVID ruined the kind of vector control activities at community level, going out door to door, going out and about, all the social restrictions? And her answer was amazing. She said that what we found is all the activities that we've been able to digitize, i.e. through the app, so dashboards where people can actually have this kind of citizen science approach, and they've really boosted, they haven't gone down at all. So again, I suppose the question comes back to Pulse. Again, the future of Pulse. I mean, it's not, I find it very exciting, that interface, because it's real. People do I use the telephone all the time. Everybody uses the telephone all the time. So again, I suppose that question leans into the evolution and further evolution of Pulse. I suppose I could ask you that again. I could ask both of you to, I don't know, perhaps balance that out. I don't know, but very interesting, actually.
But let me just respond maybe very quickly that I think as an insurer, we have also starting to move away from how a typical insurer will behave, in that sense of playing a role, right, to our customers, of just paying a claim when there is a need for medical claims, for example, or medical expense. We're trying to go into preventative care, right? So to the point of the person who asked the question, we would like to come up with content such that we can prevent these things from happening as well. And commercially, honestly, it works well for us as well. Because if less people are prevented against contracting such diseases, the less we pay in terms of claims as well. While we on the side would still want to prevent that kind of protection, but we would want to go into more preventative care for the customers. Over to Professor Syed to add on to any points.
Yeah, actually, if you look at the studies, there is no observation that people who actually take the vaccine or they buy insurance, they neglect their health. And actually, it works the other way around. Those who actually take the vaccine and also those who provide or get the health insurance, they are people who are more active in preventing or in taking care of their health, and they do follow a lot of advice by others. Those who are not taking that might be taking more risks rather than the other way around. So it doesn't work that way that has been described. Just for example, people who are taking COVID-19 vaccine, they are the one who also involved in taking care of other themselves by washing hands and also avoiding going to the public, going to the crowded places. So it doesn't work. It doesn't work that way. Maybe they're very small minority that actually do that, and I believe that in real life it doesn't work that way.
Fantastic.
Okay.
Awesome. Two brilliant answers. Yeah. Dr. Ismail, sorry, which you?
Yeah. Okay. Yeah. Okay. I think we've come to almost the end of the session. And I'd like to thank Kamran for helping out here, and then of course Prof. Syed and Mr. Go for their input, and all of you who attended here today. And of course the people in the background, the EDPA Secretariat, Francis and Wilson and the other guys who control the back activities. Thank you for helping us out. Just to remind you that we will have another webinar of this nature, and probably we're trying to get input from the Latin American countries, dengue in Latin American countries. And because we're in the Asian region, we know what's going on in our region. We need to actually find out what's happening in Latin American countries, and in Brazil, they're actually using Denguevax here. So we may have some information there. And also, a last reminder about the 6th Asia Dengue Summit, which will be on the 15th to the 16th of June of 2023. And just as a reminder as well, that the 15th of June every year is actually ASEAN Dengue Day. And soon we're going to make it as well the World Dengue Day as well. And this 6th ADS, or the 6th Asia Dengue Summit in 2023, will be in Bangkok, Thailand. So we hope that we'll see as many of you there, because this is now we're getting to meet each other, and hopefully we can see each other face to face. So with that, I'd like to thank everybody for being here today, and have a safe weekend, have a good weekend, and then stay safe. Thank you very much.